As an African American woman, I do experience oppression, and I understand how that relates to the numbers that we are seeing in the news right now. When COVID-19 came on the scene, it was clear to me, I knew we were going to have a disproportionate number of deaths in the African American community. And the reason I knew that, but I didn't expect the numbers that we are seeing. And history or time will help us explain why the numbers are so high. But in recognizing that the African American community was already experiencing epidemics of poor health and epidemics of excessive death, it wasn't surprising to me that we would have high numbers. The question is why? Why is this happening? I think we cannot underestimate the level of mistrust that exists in the African American community towards the health system in general. And this mistrust is very rational. When you look at the historical trauma that African Americans have experienced with the health system, when we go back to the days of enslavement, when healthcare was not accessible to us, when we look at Tuskegee, when we look at Henrietta Lacks, when we look at the mustard gas studies in the 40s, when we look at, I could continue to list those historical traumas, but it's not surprising that when the COVID-19 came on the scene, when you looked at social media and chat, you saw how rumors were going around that this virus would not affect us. We know COVID-19 affects human beings. It is not about the color of your skin, your ethnicity, etc. But because of the inherent social determinants of health, and what I'm going to say here is there are conditions under which African Americans are living daily that increases chronic stress. Chronic stress decreases your immune response. We're dealing with a virus, and so some of our protection against that virus involves having a strong immune system. That's one thing. The other is the lack of access to care. Yes, in the African American community, we have comorbidities of diabetes, hypertension, respiratory illness. But the bottom line is we also, because of lack of access, healthcare is a privilege in the United States. It's not a right. We don't all have access. That those diseases are also going untreated. So you have African Americans coming to this epidemic, this pandemic, with untreated comorbidities. And we cannot ignore, and this is not just exclusive to African American populations, but that's what I was asked to speak on. But if you are poor in this country and do not have the financial ability to pay for medications, you will have chronic diseases that kill you because they go untreated. So mistrust. So when the public health recommendations came out, many of us ignored them. Rumors of this will not affect African American people. People continue to congregate at their churches. Why? That's a source of comfort. It's a source of connection, not realizing the harm. On top of that, there are some governmental agencies and some political people with power in our government who chose not to take this seriously. There were events that happened in New Orleans and Chicago that should never have happened, that large groups of people congregated. What else did I want to mention? There's something that we don't like to talk about in the health community, and that's this concept of unconscious bias. Our brains are wired for bias, and we know the research shows that within the medical community, we have biases too that usually unintentionally are borne out in our behavior, in our diagnosis and treatment of patients. And oftentimes that bias causes us to make big mistakes that kill people, mistakes that kill African American patients. And the one example I'd like to give is the example of Serena Williams, the most popular athlete in the world, who, when she was giving birth, had to plead with, yell at, scream for the right treatment. She recognized that she was in a critically ill situation, and she was poo-pooed. She had to advocate for herself to save her life and her infant's life. That is not a unique situation.
Dr. Walton, if you can wrap up your comments, please.
To wrap up, what do we need? We need to reinforce what we know works. We need to reinforce how we flatten the curve, and we have to reinforce it in a way to all communities, including the African American community, that sheltering in place works, social distancing works, wearing a mask when you're in public works, and recognizing that there are many people of color who are cannot work inside the home. They're working outside the home. And so these measures of protecting yourself become even more important.